We're at the Joint Conference Budget Committees today on health, and we have Harvey Rosenthal from the New York Association of Psychiatric Rehabilitation Services. Harvey, could you please discuss a little bit of what you're going to be talking about today to the committee and then some recommendations you will make to them?
Sure. First, let me just say who I represent. The NYS brings together a coalition of thousands of people with psychiatric disabilities and providers across the state, working in tandem to advance their recovery, rehabilitation, and rights. 3 or 4 main points today. I think a big point is going to be that in order to make Medicaid reform really successful, which is really aimed at reducing costs and improving outcomes, particularly by keeping people out of hospitals and emergency rooms.
Right.
A key way to do that isn't just improving access to medication or access to clinics or to care, which seems to be the focus. It's a medical model system kind of focused on itself. But people live beyond, they have a holistic life. And a lot of the things that keep people in a hospital is stable housing, some sort of, but moving forward out of poverty, and having a connection to others, and particularly peer support,
Of course.
or peer support. So I'll be talking about the importance of reinvesting the savings from decreased hospital and emergency room use into the social determinants of health, housing, peer support, and employment. I'll be talking also about rights protections. There's a lot of big changes happening here, and in many instances they're either not being well explained, or people don't have a chance to protect their own rights and promote their rights, know how to appeal and grieve if there's a problem, and basically just really be prepared to stay in touch with what's coming down the pike. So we're asking for more education, more cultural competence, more enrollment brokering, greater use of advanced directives in electronic healthcare records, so a whole variety of rights protections. But and a big emphasis on the fact that people need much more education and support in order to go with all these changes. We think the changes might ultimately be for the good, but with a number of caveats, and these are a couple of them so far. Another one is we're focusing particularly on the pharmacy issue as an example of where the health department needs to monitor more carefully.
Okay.
And we're worried about moving to managed care as downloading government to for-profit businesses and not monitoring that enough. We have an example where too many doctors are spending too much time trying to do what was promised, which is a grandfathering, an allowance of you to stay on your medication, even if it's not on the planned formulary list. That's a change. You used to have open access in fee-for-service. Now you're in managed care plans. Getting your pharmacy, normally they have a formulary that might restrict you. They agree to open it up, but it's not really happening quite as much and as well as it should. Part of it is the health department needs to have more oversight over what the plans are saying and doing. They need to make sure that the system that they're putting in place doesn't make it so hard for doctors to make sure their patients' drugs are grandfathered that they give up. And we have a number of people. We had a big rally day last week with 800 people, and I would say 30, 40 people stood up when I asked how many people have not been able to stay on their medication and be grandfathered. So we're really going to bring a group next week or two into Albany to talk about that.
Okay, great.
Okay?
Thank you very much.
You're welcome.